Now that we've taken a few minutes to talk about the anatomy of compact bone, let's switch gears here and take a look at the microscopic anatomy of spongy bone and of cartilage. The most notable feature of spongy bone on a gross anatomical scale is the fact that the spongy bone is porous. It's full of space in between the individual trabeculae, the individual pieces of bone that twist and turn around each other. On a microscopic level, this translates into a lack of osteons. There simply are no osteons in spongy bone. This lattice, this network of bones, and we refer to them as rods and plates in spongy bone. These are called trabeculae more formally. And each piece, each trabeculum of spongy bone has a covering around it, but similar to the covering that lines the medullary cavity. In other words, the layer around each trabeculum of spongy bone is endosteum. The periosteum, remember, covers the entirety of the bone. It's the layer on the outside of the whole bone. The endosteum that covers spongy bone is going to help provide some of the resistance to the kinds of stresses that spongy bone undergoes. It's going to help provide a little bit of protection to the spongy bone from being cracked and broken. Now, when you take a look at each one of these trabeculae, when you cut them in cross section and look at the cut end, you see something that looks almost like a single osteon, but it's not an osteon. It does not have the anatomy necessary to be considered an osteon, but it does have some features. For example, you're going to see concentric lamellae. You're going to see circles of bone surrounding each other. You're going to see osteocytes in between each of the lamellae. You're going to see those osteocytes in little cavities called lacunae. There are canaliculi connecting the lacunae. And you will even find some scattered osteoblasts and osteoclasts associated with the trabeculae. Now, when you're looking at a long bone that has both compact bone and spongy bone, as well as a medullary cavity in the diaphysis, if there's bone marrow present in that medullary cavity, the marrow will extend into the spaces that are in the spongy bone. It will actually come up and fill in the spaces around each of the trabeculae. On this slide, we're looking at a diagram of the femur on the upper left-hand side, and the femur's been cut in half longitudinally so that we can see what's inside. You can see they've depicted some articular cartilage, some hyaline cartilage right at the end of the bone. They've shown a layer of cortical bone on the periphery, and then spongy bone within. Down here in the area of the diaphysis, they're showing us cortical bone, and then some spongy bone, and then a medullary cavity. Now they've taken a little square area of the spongy bone in the metaphysis, and we are looking at that spongy bone blown up in this image to the right. So these are what we would call the rods and the plates of the trabeculae. Just pieces of bone that sort of twist and turn and make up what we call spongy bone. Now, if you were to cut a trabeculum across and look at this cut face, it would look like this. So you can see where you might look at this and call it a single osteon. but it's not a true osteon. It doesn't have a central canal, and it's not sitting in compact bone, or cortical bone. It does have these lamellae, though. It does have these rows, these concentric rings of osteocytes, but there is no central cavity. In between the individual lamellae, there are lacunae, there are little sort of cavities that hold osteocytes. And then you can see right here and over here, the artist has drawn in two very big cells. These are osteoclasts. Remember, when we talked about osteoclasts, we said one of the features is that they have multiple nuclei inside of them. They're big cells, and that's what's been drawn here and here. So we can see the bone in the lamellae. We can see the osteocytes sitting in between the lamellae in the lacunae. And the artist is indicating that every once in a while there are osteoblasts, primarily surrounding the outside of this trabeculum. On this slide, you're looking at an image taken under a microscope of spongy bone. That's on the left. And over on the right, you're looking at spongy bone with an electron microscope. Over underneath the light microscope, the most notable thing is the fact that these are just pieces of bone instead of one big continuous mass of bone. So we have cut down in this image, we've cut through the spongy bone, and we're looking at all these cut surfaces of the trabeculae. And then the pink material in between, this is what would be space. This is what would be open air space. And again, if we were looking into a long bone that had bone marrow in it, these spaces, these pink spaces, would have marrow in them. Over here on the right-hand side, you can see that some of this spongy bone looks very tubular, very cylindrical, and there are other areas that look more flattened. That's why we refer to spongy bone sometimes as having rods and plates. But we call all of these twists and turns, we call all of this trabecular bone. Let's switch gears here and take a look at the microscopic anatomy of cartilage. We'll take a look at the hyaline cartilage first, and then the fibrocartilage. Remember, the key feature of hyaline cartilage under the microscope is that glassy appearance. In between the cells, the color of the cartilage matrix is very uniform in hyaline cartilage. It has a very glassy appearance to it. Remember, it is avascular and it has no innervation. Those are important features of hyaline cartilage. In terms of the cells that we find in hyaline cartilage, remember, the chondrocyte is the sort of generic cell that we find inside of cartilage. Chondro meaning cartilage. We're also going to find chondroblasts inside hyaline cartilage. The chondroblasts, similar to osteoblasts, are going to be secreting the matrix material for the cartilage, and that is just cartilage matrix. The biggest difference between the bony matrix and the cartilage matrix is how solid it is. In bone, that osteon, that mineralized osteon, has to be hard, it has to be solid in order to function correctly in bone. But in cartilage, it is semi-solid. Cartilage is a softer material than bone is, and that softness comes from the semi-solid matrix. Now, just as we saw in bone, when these chondroblasts start to secrete the cartilage matrix, they end up getting surrounded in it. And once they've become encased in it, they go on to mature and become chondrocytes. And similar to what we saw with osteocytes, these chondrocytes will have the new job of maintaining the cartilage matrix. Just as we saw in bone, the cavities or the spaces that hold these mature chondrocytes are called lacunae. Now, the perichondrium is the region around any area of hyaline cartilage. Now, this is not the same as periosteum. This is a different material. This is dense, irregular connective tissue, and it lies over areas of hyaline cartilage, except for the articular cartilage areas. Now, fibrocartilage looks very different under the microscope than hyaline cartilage does. Remember, we said fibrocartilage just has a more fibrous look to it underneath the microscope. It's not nearly as smooth and glassy looking. Just like we see with hyaline cartilage, fibrocartilage is avascular and has no innervation. We see dense bundles of collagen fibers in fibrocartilage, and those collagen fibers are going to give that fibrocartilage an increased strength and increased resilience. In terms of cells inside fibrocartilage, we see a couple of extra cells that we have not talked about yet. You find chondroblasts that are producing the cartilage matrix. They're going to secrete the matrix, become encased in it, and mature to become chondrocytes. But there's an additional cell type. The fibrocyte will be found in fibrocartilage. Now, there's a form of a fibrocyte called a fibroblast. And the fibroblast, just like the chondroblast, is going to be producing cartilage matrix. It's going to be contributing to the cartilage matrix. It's just a different cell type. And it too will get encased in the cartilage matrix and mature and become a fibrocyte. And then once the fibrocyte is present, it maintains the matrix, just like the chondrocyte does. So we have an extra type of cell in fibrocartilage that we don't see in hyaline cartilage. Similar to the hyaline cartilage, the fibrocartilage has a perichondrium, a layer of this dense connective tissue that surrounds areas of fibrocartilage. So on this slide, you're looking at cartilage in different areas and at approximately the same magnification. There's an area of hyaline cartilage here on the right-hand image. This is all hyaline cartilage. Right above it, this is perichondrium. Right below it, this is perichondrium. Now I think you can see that compared to the hyaline cartilage, which number one has a very glassy, almost smudgy look to the matrix material, and then here are the lacuna that contain all of the chondrocytes in them. Over at the edges here, this is where the chondroblasts would be located. And then they move inwards as the matrix is secreted, and they get trapped in the lacuna. So some chondroblasts up in this region. And then we enter into the perichondrium. These are not chondrocytes and chondroblasts. This is the dense irregular connective tissue that we talked about when we were discussing the hyaline cartilage. The dense irregular connective tissue that is sitting sort of on top of, surrounding these areas of hyaline cartilage. Over here in the image on the left-hand side, you can see the cells, the chondrocytes, trapped in these little compartments, these little lacunae. This is a very characteristic look for cartilage. Some blast cells, some chondroblasts would be in this area right here. And then surrounding that is the perichondrium right here. We're going to switch gears now and leave behind the anatomy of bone and the anatomy of cartilage. And we're going to start talking a little bit about how bones grow and develop. It's very interesting to note that as a fetus forms inside of its mother, the skeletal system begins not as bone, but as cartilage. We don't even really refer to it as cartilage. It's more of a template material. It's an immature sort of cartilage that forms in the shape of what will become the bony skeleton. And then as the fetus grows, this cartilage template skeleton becomes a bony skeleton. And of course it calcifies, it ossifies, it hardens as the fetus continues to grow. At birth, the infant will be born with a lot of bone, but not all bone. There are certain key areas inside the infant's body and its skeleton that are still made out of cartilage, most notably the skull, the clavicles or the collar bones, and the epiphyseal plates, the growth plates in all of the long bones will still be open, so they'll be made out of hyaline cartilage. Now, if you think about it, it's very important. It makes a lot of sense that a newborn baby or a baby that's in the process of being born has skull bones that are made out of cartilage. It's very important that the fetal and infant skull is very moldable. If it was very stiff and hard, it would be difficult, if not impossible, for the baby to be born without trouble. So the fact that the baby's head is very soft and moldable and allows for the baby to pass through the birth canal and mold its way through, sort of compress its way through to allow birth to occur. The clavicles, the collarbones as well, have to be very soft. They have to be bendable in order to deliver the baby out of its mother. Now, throughout childhood, most of that remaining cartilage is going to become bone, but some cartilage will stay open through adolescence and into early adulthood, and I'm primarily talking about those growth plates. Human beings grow throughout their teenage years and even into their early 20s, especially males. Males don't achieve their full height. Their growth plates don't close until they're into their early 20s. We call these processes where bone forms over the cartilage that makes up the early human skeleton. We call this process ossification. And depending on where the bones are in the skeleton, there are two kinds of ossification that take place. There's one called intramembranous ossification, and then there's a second process called endochondral ossification. And we'll say just a few things about both of these processes. But first, if you've never had an opportunity to see a baby in the moments after it's been delivered, this is what the head looks like. You can imagine this can be a little startling for the new parents if they've never seen this, but this is perfectly normal. The baby's head takes on this unique shape as the baby's being born. And this is good. This is important. This modeling or remodeling that happens occurs because of the pressure as the baby passes through the birth canal. And of course, this head modeling or molding will go away over the next couple days. It will go back into what we would consider a nice, normal, round head within a couple of days. All right. So the first form of ossification, of bone formation that we'll talk about is the intramembranous kind. So this, when we talk about intramembranous ossification, we're talking about the formation of bone as it occurs directly from what we call early mesenchymal connective tissue. Remember, we said a few minutes ago that the human fetus has a cartilaginous skeleton, a template skeleton that forms first. And if you recall, when we talked about connective tissue, one of the things we discussed was the fact that in a human being, when the embryo is very, very young, when it's in its second week of life, one of the very first things that develops is 3 individual layers of tissue. There is exoderm, there's mesoderm, and there's endoderm. We said that the mesoderm is where connective tissue comes from eventually. So the mesoderm cells, or what we call mesenchymal cells, are sort of immature cells that have not yet become dedicated to any one kind of tissue. So it's these mesenchymal cells that make up this cartilaginous fetal skeleton that are going to go through this process that we call intramembranous ossification. Now, there are very particular bones that go through the process of intramembranous ossification. The flat bones of the face, the cranial bones, at least most of the cranial bones, and the clavicles again, the collar bones. Now, intramembranous ossification is going to begin in utero. It's going to begin as the fetus is growing inside the mother, and it will continue through childhood and into adolescence. Now let's take a minute and talk about the physiology of this type of ossification, how it actually happens. We're not going to go into great detail about this process, but just some of the key features, especially in what distinguishes it from the other type of ossification. So, the mesenchymal cells, those cells that are in the middle layer of the embryo, the mesoderm layer, they're going to be part of this template skeleton, this cartilaginous skeleton in the fetus, and they're going to start maturing. And they make 2 very particular things. They become what we call the early osteoblasts, and they form some very early capillaries. So 2 different structures will form first during intramembranous ossification. Now the osteoblasts are going to cluster together, and they're going to form what we call ossification centers within this fetal skeleton. The osteoblasts are going to do what osteoblasts do, which is secrete osteoid. And the osteoid is going to go through that mineralization process that we discussed. And the trapped osteoblasts are going to become osteocytes. This is just the same as what we've talked about earlier. And what will happen is the ossification centers, once they form, they're going to start to expand outward. So you'll see the mineralization process, the hardening going on inside these ossification centers, and then it will grow, it'll extend as more and more osteoblasts form, and they start secreting their matrix, and it mineralizes, and the cells get trapped, and they become osteocytes, and it expands more. The spongy bone will become cortical bone out on the outside. And as I said earlier, some of these mesenchymal cells are going to be forming capillaries. And some of these capillaries will ultimately become blood vessels inside the bone. But some of them will actually get trapped in the center of what will become long bones. And it is these very early capillary bundles that are trapped in the middle of these long bones that will become the red marrow. They will become the tissue that makes the blood cells. On this slide, you can see a summary diagram of this intramembranous ossification process. And they're showing us over on the left-hand side some of those bones that we listed that go through intramembranous ossification as they're forming. Remember, some of the flat bones of the face will form this way, some of the cranial bones will form this way. This is a very particular group of bones that are going through this process. So the first step, remember, is when some of these mesenchymal cells, cells that came from the mesoderm, are going to form osteoblasts, and those will cluster into these little ossification centers. And then the next step that will happen is you'll start to see those ossification centers the osteoblasts will start secreting the matrix material, the osteoid. And then that osteoid will begin to mineralize. You can see some of the capillaries in the area are maturing to become blood vessels. Next is going to be the formation of spongy bone out of these ossification centers, and then from there the spongy bone will form the cortical bone in the outer areas. You can see that periosteum will eventually arise from that. You end up with some trapped capillaries which will become bone marrow eventually. This is the process of intramembranous ossification. Now compare that to the other type of ossification process in the fetus, which is endochondral ossification. Now, unlike the intramembranous variety, in endochondral ossification, the bone is going to develop by replacing the cartilage. So rather than seeing these ossification centers form in the mesenchyme, we're going to start to see bone actually replacing hyaline cartilage. Now it's important to note, because sometimes you'll hear people talk about how a fetal skeleton made out of cartilage will become bone. It's important to know that cartilage does not mature into bone. It can't. Hyaline cartilage is hyaline cartilage. And the cells that are in it are not cells that are able to do what the cells in bone do. So these cartilage producing cells, they have to be replaced by bone producing cells. So just like we saw with the intramembranous process, endochondral ossification begins in utero, inside the mother, and it will continue through childhood and into adolescence. The hyaline cartilage that's in that template skeleton is going to be invaded by osteoblasts. So the osteoblasts are literally going to sort of tunnel their way into the hyaline cartilage, as well as some of those early capillaries. And what happens is you start to see the first bone forming in these areas around the diaphysis that are called bony collars. And I'll show you this in just a minute so you can get a better idea. Then we will see an ossification center right in the middle of the bone. Again, the spongy bone will form first, followed by the cortical bone. And then you'll get what are called secondary ossification centers out at the ends of the bone in the epiphyseal regions. So I've been using terms like diaphysis and epiphysis here. So that's a clue that endochondral ossification is the kind of ossification that produces the long bones and also the cranial bones right at the base of the skull form this way. Now this is another diagram that helps us understand what this looks like from start to finish. I like this diagram too because it shows us exactly where we are in the life of the individual. So in the fetus here, this is all happening around week 9 of development. And remember, for a human, development lasts about 40 weeks. So we see week 9 of fetal life, and then we go up into month 3 of pregnancy, and then we go up to birth, and then we go up into childhood all the way to adolescence. So they're showing us one of these template long bones that you would see inside of a fetus. And again, it's made out of this cartilaginous material. For these long bones, this is specifically a hyaline cartilage material, again, that arose out of the mesoderm. So you can see the very first formation of bone right along the diaphysis, and we call these bone collars. We call these areas collars of bone. So right along the outside of the diaphysis of the long bone. And then you're going to get an ossification center with osteoblasts forming right in the center of the diaphysis. And just like we talked about with intramembranous ossification, this ossification center is going to start to expand outward. So what's happening is the bone is growing and it is almost pushing out the cartilage. It's going to prevent the cartilage from being maintained, and the cartilage is simply going to degrade. It's going to deteriorate as the bone replaces it. So we're going to see blood vessels forming. Remember, capillaries and osteoblasts are both important as bone first begins to develop. So we'll see spongy bone forming as well as blood vessels forming within the spongy bone. And then from that, that's going to become cortical bone. And then we'll see secondary ossification centers forming out in the epiphyses. And this continues right through birth and into childhood and all the way through adolescence. So if you look at, for example, if you take an x-ray of a long bone of a child or a teenager, you're still going to see cartilage in that bone. You're not only going to have articular cartilage, which is on the ends of the bone, but there'll be hyaline cartilage left in the epiphyseal plates, because that's where more bone can be added. More bone can be formed, and this long bone will grow. It will get longer and longer until the individual reaches their full height.